just like many of the other people here, it's an honor to be among so many heroes who have done so much and endured so much in service of our country. Now, we've been hearing some really great, hope-inspiring things about all of these efforts and technology and therapies to fix the body, heal the body, to replace lost body parts. I mean, it's wonderful science. But none of that is going to work ultimately without also healing the brain and the mind. And what you're going to hear in the panel coming up here is some truly mind-blowing breakthroughs that we are on the brink of a new golden age of brain research that's going to unlock all kinds of new therapies, and not just for post-traumatic stress disorder, but extending over into Alzheimer's and autism and maybe schizophrenia and depression because of these new technologies that we're hearing about only now. So now we're going to hear from Cagan Randall. He is co-founder of Carrick Brain Centers. He's an expert on concussions and brain disorders, injuries, Alzheimer's, PTSD, and he takes this holistic, multi-pronged approach with no one technology, but let's join a whole bunch of different things. He's about to publish some results. First, we're going to watch this video.
You know, we appreciate what they did. Like I said, they're probably one of the greatest generations, but it keeps our generation knowing we're here because of what they did. So it's pretty cool.
I first met Corey Remsburg, a proud Army Ranger, at Omaha Beach on the 65th anniversary of D-Day. A few months later, on his 10th deployment, Corey was nearly killed by a massive roadside bomb in Afghanistan.
Throwing us both into a canal.
His heart had stopped, his lungs were collapsed with a hole in the right side of his head, and burns and shrapnel and everything on the right side of his body.
So I was out of it completely the whole time. It's not like Hollywood, you do not just snap your fingers and wake up.
All of these rangers could come and see him, could visit him. I think they all thought Corey was going to be a vegetable. You know, he was just going to be this shell with drool. It was heartbreaking to see that, but they came back, and when they came back, they couldn't believe the progress.
I don't want to learn how easy it is to give up and quit.
I think this was a good lift for him. I think he views this as he's seeing results, and Corey is all about seeing results.
I was completely wheelchair bound when I came into Carrick. I now can walk minimal distance with supervision. It's very helpful and beneficial. The TBI is more recognizable now. It's more new. So you need new therapy. Carrick provides that new. I look on the TBI. They have a better understanding of the new.
I've seen good results. I've seen Corey, like I said, not just physically, but psychologically.
They're giving me the resources to continue to improve.
Here, the whole tools, if you will, are so different because they are the visual, they are the focus, they are the exercises that have been given to him. No one had ever talked to us about the connection between the visual and the brain and the balance and all of that.
Not only does Carrick offer PT, they fix the underlying issue which is a brain injury itself. I would say now, I'm more hopeful.
Sergeant First Class Corey Remsburg never gives up, and he does not quit.
First, I want to say thank you to the Infinite Hero. For one, just to see all the different thought leaders in terms of research and scientific mind and all of those things. It's really, it's just shot in the arm to be able to see some of these things, because sometimes you kind of get in your own little bubble and you're so wrapped up and concerned about the things that you're doing that sometimes you never really look out and you know, look at the trees. And so it's been a huge blessing to be here. So hats off to the Infinite Hero Foundation for putting this on. What an amazing group of people. Just to kind of tell you a little bit about Corey and a little bit about Carrick Brain Centers, how we met was Corey had, as you saw, had a significant traumatic brain injury, and from that traumatic brain injury went through a course of rehabilitation, took him several years, and he got part of his life back. And in getting part of his life back, as typical Ranger status does sometimes, they get a little cocky and got a little ahead of himself and fell down and took a lick on his head again. And they did all the scans and they did everything and they looked at him and they imaged his brain, and the great thing was that he didn't have a bleed, he didn't, you know, he wasn't in acute danger or anything like that. So he went back. But he basically lost all of his activities of daily life. So where he was walking and where he got rehabilitated to a point to where he could function, all of it was gone again. And so from a functional perspective, he was back to where pre-rehab. Going through rehab again, nothing was working. And then through some other servicemen and women that I had treated in the past in our veteran program, Corey showed up at Carrick. And in the matter of a few weeks, we got him out of his wheelchair, and he said to me, hey, I want to put some C4 on this thing, and I want to blow it up. And I said, hey, well, being from Texas, I love guns, and I try to hunt as much as possible. And so I said, hey, when we're ready to do this, we'll put some C4 on this thing, and we'll blow it up. And so I'm happy to report that Corey is now, he moved out of his parents' house, he can take care of himself, he can shower himself. He can do all the things necessary to conduct activities of daily life. He's going to be a Sun Devil soon, so he's going to get back in school at Arizona State University. And how we accomplished a lot of these things in really short order is the program that we've put together for veterans at Carrick Brain Centers. And the things that we're doing is aggressive and it's intensive, and it's very holistic. We are actively engaged in conducting research all the time, so that we can prove and are proving that our methods are not only beneficial, but they're also accelerating outcomes that currently we're not seeing today. And we're doing it also with a cost model that would be cost effective for payer systems. So, I mean, not only do we want to get men and women back into the workforce, we want to get men and women back into the workforce economically and effectively. And so we're passionate about helping men and women that are struggling with post-traumatic stress disorder and TBI, and mild traumatic brain injuries, post-concussive syndromes, head pain, migraine, a lot of the things that just show up on a daily basis. Our facility is a multidisciplinary practicing facility, and so it's so wonderful to be able to talk about nutrition and exercise and brain health and intestinal health and sleep hygiene and all those things under one roof, so that we don't have to make referrals to places where people ultimately get lost in a system that we say to ourselves, well, where am I going? What am I supposed to be doing? I'm supposed to go see this guy, and now I'm supposed to go see that guy or this girl. I'm humbled to be in a room with the thought leaders today and imaging the brain from a functional perspective, because indeed, functionality is where we need to go. It's all about function. Because you can look at somebody with a concussed noggin, and we can take that MRI, and I can't tell you how many I've seen, where the report comes back. Yeah, well, A's plugged into B. Nothing's wrong from our perspective, but then you look at this person, they have a movement disorder, they can't sleep, they're developing irritable bowel syndrome, Their life is falling apart from a lacrosse game, from a soccer game, from an IED, from other things that have happened to the individual that otherwise they didn't see that coming. So the thing that has really got me juiced up here is a lot of the things that I'm seeing is function. Function, function, function. And with that, I leave you, and thank you very much for having me.
He's the brain doctor. He's a lead researcher on the world's largest study of pro football players and concussions. He's got his own string of medical centers. He's at the very forefront of a lot of what's going on. So here's Dr. Amen.
Let me start with this question. If you knew a train was going to hit you, would you get out of the way? Nobody died. But you have to ask yourself, why are these women on tracks where there's no exit? Isn't that interesting? I started our brain imaging work at the Amen Clinics in 1991, and I was so excited. I was the director of a dual diagnosis unit. It's a psychiatric hospital unit that deals with drug addicts. This is a SPECT study. SPECT looks at blood flow and activity. It looks at how the brain works. It's different than a CAT scan or an MRI. Those are anatomy studies which show what the brain actually physically looks like. SPECT looks at function. Imaging really completely changed everything we did with our own patients. So the typical psychiatric model, I'm a psychiatrist, is symptoms equals diagnosis equals treatment. So if you tell the doctor you're depressed, he is actually going to give you a diagnosis with the same name. He's going to go, oh, you're depressed, and give you an antidepressant, which we know actually works no better than placebo in large-scale studies. If you're anxious, he'll give you an anxiety disorder diagnosis. If you have attentional problems, he'll call you ADD. Or my favorite one to explain this phenomenon, if you have temper problems and you explode intermittently, there's actually a DSM-5 diagnosis called intermittent explosive disorder. So what the hell does that mean? It means you explode intermittently. Sort of crazy. IED, anybody sort of get the pun? Psychiatrists are the only medical doctors who virtually never look at the organ they treat. Think about it. Cardiologists look, neurologists look, your orthopedic doctors look. Psychiatrists use symptom clusters to make diagnoses. And that's a huge mistake. Why? Because psychiatric illnesses like depression are not single or simple disorders. They all have multiple types with multiple causes and multiple treatments. So depression is a symptom with many different causes. And if you don't use imaging with psychiatric patients, you completely miss traumatic brain injury, you miss infections, you miss toxins, as we think is the common cause of Gulf War Syndrome 1. And these are primary causes of psychiatric illness. Imaging actually shows you the underlying biology of individual patients' brains so you can target treatment to them, not a cluster of symptoms. Is their brain overactive? Is it underactive? Is it toxic? Or is it traumatic? In our research, so Amen Clinics holds the world's largest database of brain scans related to behavior. We have 94,000 scans on people from 111 countries. So we have the busiest imaging centers in the world. And what we found, and we published this, is imaging will actually change what the doctor does 8 times out of 10. And it's not just our research. Same research from the University of Washington said the same thing. And what we get really excited about, because this is why we live, it improves outcomes. Imaging changed everything for the NFL. When we started our study in 2007, that's when Anthony Davis came to our clinic, the NFL was actively in denial that it had a problem. So Anthony Davis and I, together with the Retired Players Association, did the world's largest study on active and retired players. This is our first paper on 100 players. The blue is showing damage virtually everywhere in their brain compared to a healthy group. Now, that's awful, but with our experience at Amen Clinics, we're never about just telling you you have a bad brain. We always want to go, well, can we make it better? So we put our players on a rehabilitation program, which is mostly lifestyle interventions, diet, supplements, exercise, and 80% of them showed improvement, especially in the front part of the brain, the most human, thoughtful part of the brain. So this is one of our players, Duval Love, who is an offensive guard for the Rams, had an awful looking brain. 18 months later, dramatically better as his behavior was better. What I got really excited about with imaging is it decreases stigma because people now see their issues as medical and not moral. It decreases shame and guilt. From a family's perspective, it increases forgiveness and compassion, and it increases compliance because people want brain envy. They got like me. They want a better brain. I actually think imaging completely changes the discussion around mental health because, quite frankly, no one wants to see a psychiatrist. No one wants to be labeled as abnormal or defective, but all of us want better brains. So what if mental health was really about brain health? Imaging can change the Alzheimer's epidemic. You know, Alzheimer's is expected to triple in the next 25 years, and there's no cure for it on the horizon. In fact, if you're fortunate enough to live until you're 85, 50% of you will be diagnosed with Alzheimer's disease. Now, the really disturbing thing is Alzheimer's disease starts in your brain 30 to 50 years before you have any symptoms. So this person who's diagnosed with Alzheimer's disease at 59 likely had brain changes in her 20s. So, and if we never look, we'll never know. You knew a train was going to hit you, would you get out of the way? And this is going to be a huge problem for our veterans. Traumatic brain injury is a risk factor for Alzheimer's disease. Now, how would you know if you're vulnerable if you didn't look? The TBI epidemic with our veterans will have a 70-year tail, very much like the NFL scandals. But it can be prevented with early diagnosis, brain envy, and treatment. So imaging can help military personnel and veterans now. I've been arguing with my colleagues at the VA, and I'm actually friends with Patty Horoho, the Surgeon General. I'm like, come on, you have to image these people, because in a study we're about to publish, SPECT can distinguish between TBI and PTSD 100% of the time. Why is that important? Because the treatments are different for those illnesses. MRIs and CAT scans in people with TBI are often normal. So if you have symptoms and they tell you your brain is normal, it almost makes you feel like you're making up or imagining the symptoms. Our experience, and we published this study, scans can tell you who are at risk for suicide. But the most important thing is it can direct rehabilitation because you can have a better brain and a better life. So I just want to close with this story. I mean, this is really the mission of Amen Clinics. Change your brain, change your life. So this is Patrick Caffrey, who is a captain in the Marine Corps who sustained 3 blast injuries in Afghanistan, headaches, insomnia, anger problems. When we scanned him, we showed he had both TBI and PTSD. So I wrote to him over the weekend, and I said, so give me an update on how you're doing. And this is what he said: the more time that goes by, the better I am. The SPECT scan in 2010 started an irreversible domino effect of exponential personal growth. The scan was the only reason I admitted I had both TBI and PTSD, because like so many of my fellow veterans, he's macho. I mean, he's not going to admit he has a psychiatric problem. He wouldn't admit it if he didn't see it. Ultimately, the scan was his gateway tool to a set of brain-healthy strategies that he still uses to have a better brain and a better life. So ultimately, the question is, which brain do you want? Which of these brains is yours? And how would you ever know if you didn't look? Thank you.